Hello everyone. This is Dr. Smita Chakwade, Professor in MIMSR Latur. And as we had promised you, we have come with a wonderful drug series. And today we have got Dr. Aishwarya once again on this platform with a new drug. Yes, it's a completely uncommon drug, but getting common nowadays. So the name of the drug is Mycophenolate Mofetil. Yes, Dr. Aishwarya, can you tell us something about mycophenolate mofetil? Because as much as I have read, it was first used in 1970 in psoriasis. So can you highlight a bit of history apart from organ rejection? How was it used?
Okay, so mainly in 1947, it is discovered by the fungus from the fungus Penicillium stoloniferum. So mycophenolate mofetil is the prodrug of mycophenolic acid. So it has basically properties of antiviral, antibacterial, antifungal, and it has anti-tumor and immunosuppressive effects also. So as you have said, in 1970, it has used successfully for the treatment of psoriasis.
Wonderful. So primarily after psoriasis discovery, they also noticed that it is used along with cyclosporin in many allograft rejection cases. So that is the historical aspect. Now, basically, I would like to know from you, what is the mechanism of action of mycophenolate mofetil, Dr. Aishwarya?
Okay, so basically, as I have said, mycophenolic acid. So the mycophenolic acid inhibits non-competitively the inosine monophosphate dehydrogenase enzyme in the synthesis of purines. So purines are basically synthesized by the two pathways, de novo pathway and salvage pathway. So in de novo pathway, inosine monophosphate is converted into xanthine monophosphate by the enzyme inosine monophosphate dehydrogenase. So mycophenolate mofetil acts on this enzyme and inhibits the synthesis. So it will result into inhibition of the nucleated cells like T cells and B cells. So yes, this is the mechanism.
Yes, so basically it is going to stop the purine metabolism, and that's how it's going to block the T cell and the B cell. Yes. We would like to know how it is available. As much as I remember, as I have read, it is available in the oral form and the IV form. And can you tell us more about the metabolism and excretion, and what are the strengths that is available?
Okay, so basically the mycophenolate mofetil is metabolized in the liver by the process of glucuronidation. So mycophenolate mofetil converted into mycophenolic acid, and then it will converted into mycophenolate acid glucuronide in the liver by the process of glucuronidation. So it will get inactivated in the liver by the process of glucuronidation, and after it gets converted into glucuronide of the MPA, it will secreted into the bile, and after that it will recirculate through the enterohepatic circulation, and it will again reach into liver, and again it will converted into mycophenolic acid by the enzyme beta glucuronidase. So this is the metabolism of the mycophenolate mofetil, and that's why it has two peaks after oral intake. First peak after 1 hour after the ingestion, and then after 6 to 10 hours it will get a second peak. So the beta glucuronidase enzyme is important for the efficacy of the drug, to assess the efficacy and the adverse effects also.
Okay, so basically the metabolism happens in the liver, and the oral administration is much better compared to the IV administration. And the next important thing we need to tell our patients is to take empty stomach, this mycophenolate mofetil, so that it has a better action. And as you rightly said, that it has got two peak plasma levels. That's wonderful. So can you just tell our dermatological indications of mycophenolate mofetil? Now, few of them are FDA approved, few of them are off-label. So can you just elaborate on that, Dr. Aishwarya?
So the indications for mycophenolate mofetil are two, that is FDA approved, and we can use off-label also for the dermatologic Okay, so basically, mycophenolate mofetil is FDA approved for the allograft rejection prevention for the cardiac allografts, renal allografts, and liver allografts. And it is also used off-labelly for dermatological conditions like chronic actinic dermatosis, then psoriasis, then immunobullous disorders like pemphigus vulgaris, pemphigus foliaceus, bullous pemphigoid, linear IgA diseases, cicatricial pemphigoid, and then autoimmune diseases like systemic lupus erythematosus, discoid lupus erythematosus, and other conditions.
Atopic
So,
dermatitis.
vasculitis. Yes, in vasculitis, vaginous Church-Strauss syndrome, then nodular vasculitis. So, uh, there are many uses of mycophenolate mofetil which can be used off-label.
Yes. So primarily one is very common. The primary it was used, one is psoriasis. Second is
Yes.
all kinds of vesiculobullous disorders. So it is pemphigus vulgaris, bullous pemphigoid, so vesiculobullous disorder. Third thing is autoimmune disorders, connective tissue disorders. So in
Yes.
systemic lupus erythematosus. Then in case of atopic dermatitis, then in various vasculitis. So these are the common indications where we can use mycophenolate mofetil. I primarily have used it in psoriasis and pemphigus vulgaris cases quite a number of times because it is relatively much safer. That's why I prefer to use in these two conditions. I've definitely used it and I've found good results. You would like to know what are the adverse effects of it?
So, as the mycophenolate mofetil is recirculated by enterohepatic circulation, so it has GI side effects like nausea, vomiting, abdominal discomfort, and diarrhea. It has neurological adverse effects also like weakness, then tremors, and it has also mainly hematological side effects like neutropenia. This is the main side effect of the mycophenolate mofetil. Then genitourinary is increased urgency, frequency, and dysuria, sterile pyuria. It can also cause these side effects also, and it has main side effect that the drug is teratogenic in first trimester, so we cannot use in the pregnancy as it is an absolute contraindication for the use in pregnancy and lactation. So it has carcinogenic potential also, and it is less hepatotoxic than azathioprine, but it can lead to sepsis, infection. Yes, these are the main side effects.
So the second is the GI side effects. Third is neutropenia. Fourth is carcinogenicity. And fifth is teratogenic effect. So these are the common things which we need to take home message of mycophenolate mofetil as an adverse reaction.
Yes.
I would like to know, Dr. Aishwarya, what are the dosages of MMF?
Okay, so as I have said, mycophenolate mofetil used in T cell mediated diseases and B cell mediated diseases also, as it inhibits the purine synthesis. We have to adjust the dose according to the pathogenesis of the disease. As we in the T cell mediated diseases, we have to use 25 to 35 milligram per kg dose for the T cell mediated diseases, and for the B cell mediated diseases we have to use higher doses like 35 to 55 milligram per kg, and in immunobullous disorders we have to use higher doses to cure the condition. So yes.
Which are the available drug dosages available in India?
Okay, so mycophenolate mofetil in enteric coated tablets are available in 360 milligram, and the other form is available in 500 milligram. So we have to start the dose by 500 milligram and at night for 1 week, and then we can escalate the dose according to the need. And once the dose is stable, we continue that stable dose, and we can monitor the blood levels and CBC for the neutropenia and other conditions.
Yes, we will move to the next question, monitoring guidelines. So how often would you like to check in for the neutropenia with MMF?
Okay. So, firstly, the baseline monitoring guidelines and other are follow-up guidelines. So, in the baseline, we have to monitor for the CBC, complete blood count, then renal function test, liver function test, and we have to get the titers of hepatitis B and C, as mycophenolate mofetil can reactivate these infection. And in follow-up investigations, we have to do the CBC investigation along with the other LFT and RFT by the interval of every 2 week following dose escalation every 2 week, and when the dose is stable, we have to monitor every 2 months with all these investigations.
So
Yes, and
primarily first, as soon as the patient comes to us, we are going to do a complete baseline. So in that baseline, we are going to check for the hepatitis B, we are going to check for HIV, we are going to see hepatitis C infection, we are going to check for the CBC, LFT and renal function test. Yes. And once we start the dose and we are escalating the dose, we have to call them every 2 weeks. And once we
yes.
keep the dose stable and the patient is comfortable, then you can call them every month. Yes.
Okay. I have forgot to tell that in baseline investigation, we have to do the pregnancy test, as this drug is teratogenic.
Yes, we cannot forget that since it's teratogenic drug. Great. Can we know the drug interactions of MMF?
So the drugs which increase the levels of MMF will lead to the altered levels of mycophenolate mofetil in the blood. So we have to take in consideration that the drugs which compete, as the drug is bound to the albumin, so we have to take in consideration the protein binding drugs. So salicylate, phenytoin and theophylline are the drugs which compete for the albumin binding sites. So we have to check for these drugs if the patient is taking these drugs or not. And the serum concentration of MMF will decrease with the antacids, proton pump inhibitors, and with iron. So this will decrease the absorption, gastric absorption of the drug. So we will have to check these drugs. And drug which decrease the enterohepatic circulation, we also need to take in consideration that the MMF is mainly in, through enterohepatic circulation. So the drugs penicillin, cephalosporins, then macrolides, fluoroquinolones are the drugs which interact with MMF. So these are the main drugs which we will have to take into consideration.
So primarily it is antacids, proton pump inhibitors and all these antibiotics which have a great interaction in this particular MMF. And
Yes.
this is how we'll use. Can you just give a very quick take-home back message for all our postgraduates? I mean, just an overview, a quick overview. MMF action, MMF indication, and MMF side effects.
Okay, so as we have discussed, MMF will mainly lead to decrease the purine synthesis, and it will lead to the inhibition of the T cells and B cells. It mainly inhibit the activated lymphocytes in the disease activity. So it mainly inhibits the diseased lymphocytes. So it will not affect the normal organs or cell types. So we have to take in consideration in corticosteroid sparing agents. We can use MMF in psoriasis. So in atopic dermatitis, chronic actinic dermatitis, immunobullous disorders like pemphigus, foliaceus vulgaris, then bullous pemphigoid, and in autoimmune diseases, vasculitis, we can use MMF. So for the drug doses, I have just said that we have to look for T cell mediated diseases, B cell mediated diseases. The dose is different, and for the immunobullous disorder, we have to use higher doses. And we have to check for the adverse effects like gastrointestinal, hematological, neurological. It has a toxogenic potential, carcinogenic potential, and it will lead to infection. So we have to check for these side effects while we are giving the treatment. And in the monitoring, we have to just we have discussed we have to monitor CBC, LFT, RFT, hepatitis B and C titers, and in follow-up investigations we have to follow up the patient for every 2 weeks till we escalating the dose, and after the dose is stable we have to monitor the investigations for 2 months, every 2 months. So yes, these are the main points.
So this was a wonderful overview, Dr. Aishwarya. Dr. Aishwarya is our second year resident in MIMSR, doing her post-graduation master's degree MD in MIMSR Latur. And I'm so thankful to you, Dr. Aishwarya, for giving such wonderful inputs on this beautiful drug called as Mycophenolate Mofetil.
Thank you,
You
ma'am.
postgraduate students can definitely log into our YouTube and understand more about the drugs.